A 72-year-old woman in Ohio took warfarin for atrial fibrillation. Her cardiologist had carefully adjusted the dose for years. Her INR was stable. Then she started drinking ginger tea twice a day for her arthritis. She didn't tell her doctor. She didn't think tea counted as medication. 6 weeks later, she was hospitalized with internal bleeding. Her INR had nearly doubled. She survived, but barely. Stories like this play out in hospital emergency departments every single day. Seniors taking blood thinners, warfarin, apixaban, rivaroxaban, dabigatran, or daily aspirin. Combine them with natural remedies they assume are harmless. Ginger, turmeric, garlic, ginkgo, fish oil, cranberry, and sometimes the combination puts them in the hospital. Sometimes it kills them. Today, I'm walking you through every well-documented drug-herb interaction with blood thinners that seniors must know. The 15 most dangerous combinations. The signs of bleeding that require immediate medical care. The herbs that paradoxically reduce blood thinner effectiveness, leading to clots and strokes. The supplements that are safe. The 7-step protocol for combining any natural remedy with a blood thinner. And the exact wallet card to bring to your pharmacist before changing anything. By the end of this video, you'll know exactly what to avoid, what to monitor, and how to talk with your healthcare team. Because this isn't optional information. This is life or death information. Let me start by being precise about which medications we're talking about. Blood thinners fall into 2 broad categories, and they interact with herbs differently. The first category is called anticoagulants. These affect the clotting cascade, the chemical reactions that turn blood into clots. The major anticoagulants are warfarin, sold as Coumadin or Jantoven, apixaban, sold as Eliquis, rivaroxaban, sold as Xarelto, dabigatran, sold as Prasugrel, and edoxaban, sold as Savesa. The second category is called antiplatelets. These prevent platelets, the tiny cells in your blood, from sticking together. The major antiplatelets are aspirin at any daily dose, clopidogrel, sold as Plavix, ticagrelor, sold as Brilinta, and prasugrel, sold as Effient. Many seniors take both, a daily aspirin plus an anticoagulant, or 2 antiplatelets together, depending on their cardiovascular history. This combination, called dual or triple therapy, dramatically increases the importance of avoiding herb interactions because the baseline bleeding risk is already elevated. The reason these medications interact so strongly with herbs comes down to 2 mechanisms. First, many herbs have their own antiplatelet or anticoagulant effects. They affect the same biological pathways as the medications. When you combine them, the effects add up, sometimes dangerously. Second, many herbs affect the cytochrome P450 enzyme system in your liver, particularly an enzyme called CYP2C9 that metabolizes warfarin. When an herb inhibits CYP2C9, warfarin levels rise. When an herb induces CYP2C9, warfarin levels fall. Either direction is dangerous. Too much warfarin causes bleeding. Too little causes stroke. Quick pause. Before we go further, if you're on any blood thinner, do not panic during this video. The goal isn't to scare you away from herbal remedies entirely. The goal is to give you the specific information you need to make safe choices. Many of the herbs we'll discuss are safe in food amounts. Some are even beneficial in supplement form when properly coordinated with your doctor. The information that follows is what most pharmacists wish their patients knew before they walked into the consultation. Stay with me. Let me now walk you through the most dangerous herb interactions with blood thinners. I'll cover 15 herbs organized by the type of interaction. Each one matters. Several are in supplements seniors take daily without realizing the risk. The first category is herbs that have strong antiplatelet or anticoagulant effects of their own. Combining these with prescription blood thinners produces additive effects. Garlic, particularly aged garlic extract and high-dose raw garlic. Garlic contains allicin and ajoine, compounds with documented antiplatelet activity. Studies show that 2 to 4 grams of fresh garlic daily, or equivalent supplement doses, can measurably extend bleeding time. For occasional culinary use, garlic is fine. For daily supplementation alongside warfarin, apixaban, or daily aspirin, garlic adds real risk. The interaction with aged garlic extract used at the doses I covered in my garlic for blood pressure video, 600 to 1200 milligrams daily, is mild but meaningful. Coordinate with your pharmacist. Ginger, especially in supplement form or concentrated tea. Ginger inhibits thromboxane synthesis, the same pathway aspirin works on. 1,000 to 2,000 milligrams of standardized ginger extract daily, the dose that works for inflammation, produces measurable antiplatelet activity. The woman whose story I opened with was drinking only ginger tea, but at high frequency. The interaction is real. Limit to small amounts in food when on blood thinners, or coordinate supplement use carefully with your pharmacist. Ginkgo biloba, one of the most studied and most dangerous interactions. Ginkgo contains ginkgolides that strongly inhibit platelet aggregation. There are multiple case reports of serious bleeding, including subdural hematomas in seniors, from ginkgo combined with aspirin, warfarin, or other blood thinners. The dose typically taken for memory or circulation, 120 to 240 milligrams daily, produces clinically significant antiplatelet effects. If you take any blood thinner, avoid ginkgo. There are no safe combinations established. Turmeric and curcumin, particularly at high doses with bioavailability enhancers. Plain culinary turmeric in food is fine, but standardized curcumin extracts at 500 to 1,500 milligrams daily, combined with piperine or in phytosomal form, have measurable antiplatelet effects. Several case reports describe elevated INRs in patients on warfarin who started curcumin supplements. If you take turmeric supplements at therapeutic doses while on blood thinners, your doctor needs to know. Monitor for bruising. Curcumin combined with warfarin should be approached cautiously. Fish oil at high doses. Omega-3 fatty acids reduce platelet aggregation. At doses below 1,000 milligrams of combined EPA plus DHA daily, the effect is minor and the cardiovascular benefits outweigh the risk for most seniors. At doses above 3,000 milligrams daily, common in prescription Lavazza and high-potency over-the-counter products, the bleeding risk becomes measurable. Stop high-dose fish oil 1 week before any surgery. If you're on a blood thinner and take fish oil, keep your dose modest unless your doctor specifically recommends otherwise. Vitamin E at high supplement doses. Vitamin E above 400 international units daily inhibits platelet function. Combined with blood thinners, it increases bleeding risk. Standard multivitamin doses of 15 to 30 international units are fine. Standalone vitamin E supplements at 400 international units or higher are not advisable on blood thinners. Saw palmetto, common in men's prostate health supplements, has mild antiplatelet effects. Case reports describe bleeding complications when combined with blood thinners. Coordinate use with your urologist or primary care doctor. Pattern interrupt. If you're already mentally checking your supplement shelf, that's the appropriate response. Many seniors take 3 to 7 of the herbs I just listed without realizing the cumulative effect on their blood thinner. The interactions add up. Taking ginkgo, fish oil, garlic, and ginger simultaneously while on apixaban is genuinely dangerous, even if each individual dose seems modest. Subscribe to the channel for more practical safety guides like this. I publish 2 evidence-based reviews each week, and the free wallet card with all the interactions listed is in the description. The second category is herbs that increase warfarin levels by inhibiting metabolism. This category mainly affects warfarin, not the newer direct oral anticoagulants like apixaban or rivaroxaban. Cranberry juice and cranberry supplements. Long debated but consistent evidence shows cranberry can increase INR in some patients on warfarin. The mechanism involves inhibition of CYP2C9. Small amounts of cranberry juice are generally safe. Daily large quantities, 8 ounces or more, or concentrated cranberry supplements have caused dangerous INR elevations. If you use cranberry for urinary tract infection prevention, talk to your doctor about how much is safe with warfarin, or switch to alternatives like D-mannose with your doctor's approval. Grapefruit and grapefruit juice strongly inhibits CYP3A4 and to a lesser degree CYP2C9. While warfarin is metabolized primarily by CYP2C9, grapefruit can affect related pathways and has been associated with increased bleeding. Grapefruit also strongly interacts with apixaban and rivaroxaban, increasing their levels significantly. If you're on any of these blood thinners, avoid grapefruit and grapefruit juice. This is not optional. The interaction is well documented and dangerous. Dongquai, a Chinese herb used for menopausal symptoms, contains coumarin-like compounds with their own anticoagulant activity, plus CYP2C9 inhibition. Major case reports describe massive INR elevations in women on warfarin who started Dongquai. Strongly avoid on any blood thinner. Danshin, another Chinese herb, also known as Salvia miltiorhiza, used for cardiovascular conditions, has multiple mechanisms that increase bleeding risk with warfarin. Documented case reports of serious bleeding. Avoid on blood thinners. Chamomile, particularly in concentrated supplement form, contains coumarins. Occasional cups of chamomile tea are likely fine. Daily concentrated chamomile supplements have been linked to elevated INRs. If you use chamomile regularly, tell your doctor. The third category is herbs that decrease warfarin effectiveness, the opposite problem, leading to potential clots. St. John's wort, used for mild depression, strongly induces CYP2C9 and CYP3A4, reducing levels of warfarin, apixaban, rivaroxaban, and dabigatran. This means your blood thinner becomes less effective, raising your risk of stroke or pulmonary embolism. Major case reports describe strokes in patients who started St. John's wort while stable on warfarin. Avoid completely on any blood thinner. Ginseng, both Asian and American varieties, has variable effects on CYP enzymes, generally tending to reduce warfarin levels. Case reports describe both increased and decreased INRs. Unpredictable. Avoid on blood thinners unless your doctor specifically approves. Green tea, in normal beverage amounts, is generally safe. Concentrated green tea extracts at high doses contain enough vitamin K to interfere with warfarin and reduce its effectiveness. Standard green tea drinking is fine. Green tea extract supplements should be approached with caution. Coenzyme Q10 at high doses can reduce warfarin's effectiveness due to structural similarity to vitamin K. Doses up to 100 milligrams daily are generally safe. Doses above 200 milligrams may interfere. Coordinate with your doctor if you take CoQ10 alongside statins. The fourth category is foods high in vitamin K. These aren't herbs exactly, but they're frequently asked about. Vitamin K is the antidote to warfarin. Foods very high in vitamin K, kale, spinach, collard greens, Brussels sprouts, broccoli, and green tea in large quantities, can reduce warfarin's effectiveness. The fix is not avoidance. The fix is consistency. Eat the same approximate amount of these foods every week. Your warfarin dose is adjusted to your typical vitamin K intake. Sudden changes in either direction destabilize INR. If you've been eating no green vegetables and then start a kale-heavy diet, your INR will drop and you'll be at increased clot risk. The opposite is also true. Keep your green vegetable intake roughly consistent week to week. Pattern interrupt. I want to address something important. The newer direct oral anticoagulants, apixaban, rivaroxaban, dabigatran, edoxaban, are sometimes called DUACs or NOACs. They do not require the careful vitamin K consistency that warfarin does. They have fewer dietary interactions, but they have more concerning interactions with grapefruit, with strong CYP3A4 inhibitors, and with antiplatelet herbs. So switching from warfarin to apixaban does not solve all interaction problems. It just changes which interactions matter most. The myth that DOACs are interaction-free is wrong. They have fewer interactions, not no interactions. Now let me cover supplements that are generally safe for seniors on blood thinners when used appropriately. Vitamin D, no significant interaction with blood thinners. Important for bone health and falls reduction in seniors. Safe to take. Magnesium, particularly glycinate or citrate for sleep, no interaction with blood thinners. Safe. Calcium, no interaction with blood thinners. Important for bone health. Safe. Probiotics, generally no interaction. Safe. Vitamin B12, no interaction. Important for seniors, especially those on metformin or proton pump inhibitors, which can reduce B12 absorption. Safe. Low-dose melatonin, under 1 milligram, no significant interaction. Higher doses have not been adequately studied with blood thinners. Use low doses if needed. Tart cherry juice, at the dose used for sleep, mild antioxidant effects, but no significant antiplatelet activity at study doses. Generally safe, but if combined with very high omega-3 or other antiplatelet supplements, the cumulative effect could matter. Tell your doctor what you're taking. Aged garlic extract. At standard doses, mild antiplatelet effect. Generally safe with monitoring. Discuss with your pharmacist before starting. Coenzyme Q10. At low to moderate doses, generally safe. Discussed above. Let me now cover the warning signs that anyone on blood thinners must recognize. These signs require immediate medical evaluation. First, unusual bruising. Small bruises are normal on blood thinners, but large bruises that appear without obvious trauma, bruises that keep growing, or bruises in unusual locations like the abdomen, back, or thighs are warning signs. Second, bleeding that won't stop. A nosebleed lasting more than 15 to 20 minutes despite pressure. A cut that keeps oozing. Bleeding gums that don't stop after brushing. These suggest your blood is too thin. Third, blood in urine or stool. Red, pink, or tea-colored urine. Bright red blood in stool or black tarry stools. Both require immediate medical evaluation. Fourth, coughing or vomiting blood. Either is an emergency. Call 911 or get to an emergency room. Fifth, severe headache, especially with confusion, weakness, vision changes, or trouble speaking. This could indicate bleeding in the brain, a medical emergency. The risk is especially high after a fall, even a minor fall. Seniors on blood thinners who fall should be evaluated medically even if they feel fine, because slow bleeding in the brain can become life-threatening hours after the injury. Sixth, unexplained fatigue, paleness, shortness of breath. These can indicate slow internal bleeding causing anemia. Seventh, abdominal pain, especially with vomiting or fainting, can indicate intra-abdominal bleeding. If any of these occur, call your doctor or go to an emergency room immediately. Bring a list of every medication and every supplement you're taking. Bring the actual bottles if possible. The emergency team needs to know what's in your system to manage you safely. Pattern interrupt. The free wallet card linked in the description includes a list of all the herbs and the warning signs, plus a section to fill in with your specific medications and supplements. Print it. Keep one in your wallet, one on your refrigerator, and one with your medical records. If you're ever in an emergency, this card can save your life. Now let me give you the 7-step protocol for combining any natural remedy with a blood thinner. Step 1. Never start any supplement without telling your doctor or pharmacist first. This is the foundational rule. Most interactions can be managed safely if your healthcare team knows about them. The dangerous situations almost always involve patients who didn't tell their doctor what they were taking. Step 2, bring everything to your appointment. Every supplement bottle, every vitamin, every herbal tea, every protein powder, even things you take occasionally. Pharmacists are trained to spot interactions, but they can only spot interactions in products they know about. Step 3. Ask specifically about the herbs we discussed today. Ginkgo, garlic, ginger, turmeric, fish oil, vitamin E, dong quai, danshan, cranberry, grapefruit, St. John's wort, ginseng, coenzyme Q10, saw palmetto, and high-dose green tea extracts. Many patients are too embarrassed to ask. Don't be. The pharmacist sees these questions every day. They want you to ask. Step 4. When adding a new supplement, start one at a time and wait at least 2 weeks before adding anything else. This lets you and your doctor identify any effect from the new addition. If you start 3 things at once and your INR jumps, you won't know which one caused it. Step 5. If you're on Warfarin, get more frequent INR checks for the first month after starting any new supplement, herbal tea, or significant dietary change. Your doctor may need to adjust the Warfarin dose. Step 6. If you're on a DOAC like apixaban or rivaroxaban, you can't easily monitor effects through blood tests. So the protocol is even more conservative. Coordinate every supplement carefully and watch for warning signs. Step 7. Before any surgery, dental procedure, or invasive medical test, tell every member of your healthcare team about every supplement you take. Many supplements need to be stopped 7 to 14 days before procedures to reduce bleeding risk. This includes fish oil, ginkgo, garlic, ginger, turmeric, vitamin E, and more. Even routine dental cleanings can benefit from this disclosure.
Let me now address some specific scenarios I hear from viewers regularly. I take ginger tea for my arthritis. Is 1 cup a day safe with my apixaban? 1 cup of ginger tea per day is unlikely to cause problems. The risk rises with concentrated supplements, multiple cups daily, or combining with other antiplatelet herbs. Tell your doctor at your next visit. Monitor for any new bruising. If concerned, switch to a non-antiplatelet, anti-inflammatory approach like topical heat, gentle exercise, or coordinate use of ginger extract supplements with your pharmacist. My friend swears by ginkgo for memory. I'm on Warfarin. Can I try it? No. Ginkgo's interaction with blood thinners is too well documented to be safe at any dose. There are better evidenced approaches for memory in seniors, exercise, sleep, social engagement, and a Mediterranean diet that don't carry bleeding risk. I want to use turmeric for my joint pain, but I'm on apixaban. What's the safest approach? Discuss with your prescribing doctor before starting. If approved, start at the lowest effective dose, 500 milligrams of curcumin extract daily. Monitor for bruising for 4 weeks and don't combine with other antiplatelet herbs. For some patients on apixaban, low-dose curcumin is acceptable. For others, the risk is too high. The answer depends on your individual situation and your cardiologist's judgment. I love grapefruit and orange juice in the morning. I just started Xarelto. Do I really have to give it up? Yes. Grapefruit and grapefruit juice significantly increase rivaroxaban levels, raising bleeding risk. Switch to orange juice, apple juice, or another fruit. This one is non-negotiable. I'm on aspirin only, not warfarin or one of the newer drugs. Do these interactions still matter? Yes, though the magnitude is smaller. Daily aspirin alone has a modest baseline bleeding risk. Adding antiplatelet herbs like ginkgo, garlic, ginger, or high-dose fish oil can push that risk up significantly. The same precautions apply. My doctor put me on dual therapy, aspirin plus clopidogrel, after my stent. How careful do I need to be? Extremely careful. Dual antiplatelet therapy already has a meaningfully elevated bleeding risk. Adding antiplatelet herbs is particularly dangerous in this population. Avoid all the herbs in Category 1 I listed earlier. Coordinate every supplement with your cardiologist. What about cooking with garlic, ginger, and turmeric? Do I have to give up Mediterranean cooking? No. Culinary amounts of these spices in food are generally safe. The amounts in normal cooking are far below supplement doses. A clove of garlic in a stir-fry, a teaspoon of turmeric in a curry, a small piece of fresh ginger in soup. None of these accumulate to clinically significant antiplatelet effects. The Mediterranean diet remains beneficial. The concern is concentrated supplements, not food. Let me give you the practical recommendation. If you're on any blood thinner, warfarin, apixaban, rivaroxaban, dabigatran, daily aspirin, clopidogrel, ticagrelor, or any combination, your relationship with herbal supplements is fundamentally different from someone not on these medications. Most herbs that seem benign carry real risks for you that they don't for others. The safest approach is conservative. Stick to evidence-based supplements without bleeding risk. Vitamin D, magnesium glycinate, vitamin B12, calcium, low-dose melatonin. Use spices in food, but avoid concentrated supplement forms of the antiplatelet herbs. Strictly avoid ginkgo, dong quai, danshen, St. John's wort, and high-dose green tea extracts. Limit fish oil to modest doses unless your cardiologist specifically prescribes higher amounts. Avoid grapefruit on apixaban, rivaroxaban, or other DOACs. Keep vitamin K intake consistent if you're on warfarin. For any supplement you're considering, follow the 7-step protocol. Tell your doctor. Tell your pharmacist. Start one at a time. Monitor for warning signs. Get INR checks if on warfarin. Stop before procedures. And carry the wallet card with you. What this protocol will do for you, it will dramatically reduce your risk of bleeding hospitalization, stroke from blood thinner ineffectiveness, and dangerous procedural complications. It will give you a productive partnership with your healthcare team rather than parallel decisions made without coordination. It will let you safely incorporate some natural approaches alongside your medications, rather than abandoning either approach entirely. What this protocol will not do, it will not allow you to use every popular supplement you see advertised. Blood thinners come with real trade-offs. The trade-off you've already accepted is that the medication is preventing strokes or clots that could kill you. The trade-off that comes with that is reduced freedom to use bleeding risk supplements casually. That's the deal. It's not a flaw of the medication. It's a feature of how your body is now being protected. The cardiologist who prescribed your blood thinner did so because the consequences of not taking it were worse than the consequences of taking it. Honor that decision by managing the medication well. That means coordinating every supplement, every herbal tea, every dietary change with your healthcare team. It means using this video as the starting point for that conversation, not as a substitute for it. The information here is comprehensive but not exhaustive. Your specific situation may have nuances only your prescribing doctor can address. Bring this list, have the conversation, then make informed decisions together. In the next video on this channel, I'm reviewing the best time of day to take vitamins after age 65, a topic that sounds simple but has surprising research behind it that can dramatically affect absorption and side effects. If you haven't subscribed yet, the link to the free wallet card listing every interaction discussed in this video is in the description. And thank you for watching. Stay safe, ask questions, and never start anything new without checking with your healthcare team.